Right, so we're going to be hopefully surviving the storm and learning how to deal with this. As you will know, this has been a worldwide pandemic, and we now know that there have been over 3 million cases, 235,000 deaths, maybe more, probably quite a lot more that we don't know about. But the good news is there appear to have been over 1 million recoveries, so that we're getting an idea about what the mortality is. The best way of looking at mortality is actually to look at the confirmed deaths per 100,000, because this is the only figure which is actually reliable.
What do we do in terms of opening our clinics and working? I guess that what I'm going to say now, everybody is doing the same. So since I'm the first speaker, I will just briefly review it. We all have for the patients, face masks and gloves, the social distance of 2 meters, no more than 10 persons in one room. Checking patient temperature for the patient, and everybody who have any kind of symptoms would not be allowed to go to the private clinic, and only one accompanying person. And for the staff, we are fully covered with masks and gloves, have daily health statement, they check temperature, face covers, perspex shields for our machines, slit lamps and desks, clean. We are covered, it works well. We know that in our countries, there was no single case in which even doctors who treated patients with corona, if they were fully covered, nobody was infected. So it does work. So I guess we cannot do much more unless we will go like this. But I think we are pretty well prepared for it.
That's from PI magazine. And this is a report we made with Dr. Wai-Chin Lam from Hong Kong. He was in Toronto some years ago, and also Dr. Arun. And we have less patients to see now, down near the 60% in the surgeries, as I compare with what Dr. Steve Charles is doing. We are doing far less surgeries, but we're still doing detachments, vitrectomies, but in some cases of long-standing macular tractions that we have to do because the retina cannot wait. And the elective surgeries such as cataract and procedures such as laser, they are not being performed that much unless we have glaucoma patients, for example, that have this high pressure or malignant glaucoma, and so we have to refer them to the OR, and they cannot wait as well.
I was in the middle of a grand European, African, and Indian media tour to expose more doctors and industry about PI and Kick magazine. Vietnam was very aggressive to quarantine at that time, and I didn't have any symptoms. I didn't know I was COVID-19 positive until about 3 or 4 days into quarantine. A transition happened when I was there in the hospital. I became not Matt the CEO anymore, but Matt the journalist that was trained at the Medill School of Journalism at Northwestern. And, you know, I suddenly realized that what I was going through in terms of our ophthalmology community and the friendships that I have near and dear, I needed to get that story out. And so I spent some time writing and reflecting. What I realized quite quickly was that we needed to move from ebooks, which we had been publishing, to essentially almost like a crisis mode where we needed to start covering things in depth. So very quickly, we transitioned our website to start covering the COVID and COVID situation as it relates to ophthalmology. I think it's important to note that right now, even if you've got something going on as far as a 2.2 millimeter incision, that's really important. Somehow relate that back to this story that we're in, which is the pandemic. Many people I've talked to have said this is bigger than 9/11. I think that's fairly obvious, but this is the story of our lives. And as a journalist, it's important for me to cover it, but it's also important for our sources to know that for stories to have meaning in this day and age, to relate it back to COVID means actually people will read that a lot more.
Remote consulting is going to work, Fran, to segment things, but not for getting up close and personal as we normally do, and obviously not for retinal stuff. There's some new software out there that patients can download, so you can have your home patient plan. And ASCRS and other organizations are putting together strategies so that we can start to reopen life, and how we're going to do this after the worst has passed, and do it in a safe way to protect us, our patients, and so forth.
We all have to rethink what the future will bring. A couple of things that have perhaps not been brought up is about research, about transplantation. Are we going to handle tissue differently? I know that I'm an adjunct professor at Moran, and they are continuing their vivarium and just their very critical studies that were ongoing and otherwise have pretty much stopped. How that's going to affect things, particularly in the USA with FDA requirements. It's been really interesting to see how many kind of false starts we've had in terms of what medications might be effective. Are they effective? What can we use, without anything close to the type of clinical trial. Of course, there's been no time for such things, of what we've anticipated and expected in the past.
It's important to remember that this is not the first time. Every 100 years we go through an epidemic, so I hope the next generation will be more ready than us for the next epidemic in 100 years. But my view of the future is very positive. The number of patients per day is reduced, but I think it's true for most of you. I am traveling less, I am working more. Therefore, the number of patients per month should be almost the same. If we guarantee our patient a treatment in a clean and risk-free area, I think they will have less fear, especially outside the hospital. So I can foresee a good role for the private centers. Staff is reduced per shift according to the needs. The clinic is cleaner, smells good all the time. I'm less stressed and working with higher quality per patient, so I will not be able to go back to the old way. I think we should adapt and adopt new solutions. And I thought about the 3S, saving, selection, and software. Saving because we will be more careful, just keep quality, but not wasting. Selection of case instrument techniques and hygiene measures, and software because technology will help smart connection both in care and education. So if health and money last, this will be a very important time in our life and sign a beginning of a new era. I would like to greet you with these last photographs and video that I just take. It's the sunrise just yesterday, and I hope with this to leave you with hope.